As the number of coronavirus cases continues to swell in the U.S., models project infections in some of the worst-hit American cities, New York, New Orleans, and Detroit, are at or near their peak.
I don't know if we can bend the curve in Detroit. They failed to do it in New York, and the loss of life is almost unimaginable.
We know our hospital systems are so overwhelmed. Access to care is not as easy as it was before. I see a lot of potential for bad outcomes.
Virus-related deaths in Wayne County, where Detroit is, are the highest in the U.S. outside of New York City and Nassau County, which is also in New York.
There is a truism in epidemiology that the people who suffer the most tend to be the poorest and the most marginalized in the society, no matter what the society is, no matter what the disease is.
Detroit, a city slow to recover from the 2008 financial crisis, is fighting again, this time against the coronavirus. So, how is the city responding? And will Detroit prove more vulnerable to this crisis?
When you think about an epidemic, often we always look at the pathogen, and that's just part of the story. The other part of the story is the host and the environment.
Dr. Abdul Al-Sayed is an epidemiologist who previously served as the health director for the city of Detroit. He says underlying vulnerabilities in the city have fueled the increase in Detroit's COVID-19 cases.
Detroit, unfortunately, in so many circumstances, has been the hardest hit by a number of dynamics that disproportionately affect low-income people and people of color in our country.
More than a third of people in Detroit live in poverty, and the prevalence of underlying health conditions such as diabetes, asthma, and heart problems are much higher there than elsewhere in the country.
All of those things create a community that is uniquely vulnerable.
The outbreak has been particularly fatal for the state's Black residents, who make up 40% of Michigan's reported deaths, but only 14% of the state's total population. The city of Detroit, where most of the state's cases are, is majority Black.
Hey, Dr. Asha here. I'm getting ready to go to the Pope Francis Center.
Dr. Asha Shajahan is a family medicine physician and medical director of community health at Beaumont Grosse Pointe.
I think I'm good.
She's been treating COVID patients via telemedicine and volunteers 3 days a week at the Pope Francis Center, a homeless service provider in Detroit.
About to get started with my day.
Some homeless service providers in Detroit have been forced to close or reduce services to adhere to government guidelines.
Think about all the things that we're telling people to do at home. Stay at home. They don't have a home to stay in. Wash your hands. Where are they going to have access to wash their hands with soap, for 20 seconds?
You're feeling better now, right?
Dr. Shajahan screens patients for COVID-like symptoms and, if necessary, refers them to a city facility where they can isolate and receive further medical attention.
We need to take care of everybody, and if patients don't have the ability to get screened, then they're potentially spreading it to others and putting themselves at risk.
The Pope Francis Center has shifted operations outdoors so that guests have access to water, soap, and medical attention while socially distancing.
We have hand washing stations available for the patients.
We know that poverty and health go hand in hand. Many of the patients that I see, they already have asthma, they already have COPD, they already have mental health issues. So having the anxiety of COVID, in addition to everything else that's going on, puts them at higher risk.
Mayor Mike Duggan has pushed back on the idea that the city's poverty contributed to it being a hotspot.
I spoke to Dr. Mark Zervis this morning, who was also deeply disturbed by this coverage. And he said, there is no evidence that the coronavirus checks your bank account.
I do agree that the coronavirus doesn't look at people's pockets, but I do think there are people that are at higher risk of contracting the virus because of their comorbidities. It's not only just the elderly, but it's also people that are at higher risk because of their social circumstances.
As Detroit residents worry about staying healthy, the impact this coronavirus will have on the city's economy is still unclear. For a city that has seen an economic crisis before, some fear the effects will be felt long after this public health crisis is over.
Unfortunately, this is sort of a sucker punch that comes right at a moment where folks felt like the worst was behind us, and it's hard to see.
We're hoping everyone's doing good, staying safe. We'll be back on Monday.